Okay, so today we're talking about the microbiome, and I'm going to talk about what it is, and I'm also talking in this talk about the body biome. The good thing for you guys is that I generally make these really short, so I'm planning to be done in about 15 minutes, and we're 6 after now, so I'm going to go ahead and get started. Hope you like my graphic on the Zoom page. So I just want to remind you that each patient carries his or her own doctor inside of him or her. This is a quote by Norman Cousins, and he's an expert in reversing diabetes. I've got all his books. All right, and I'm also reminding everybody that stress, when I talk about stress, I'm talking about the mental, emotional, spiritual overlap of stress. And then this is my graphic that I created just to show all the different aspects that we look at in functional medicine and how they overlap on the mental, emotional, spiritual. And what we're talking about today actually kind of covers each of these areas. It's something that involves each of these areas, the microbiome. And this is the functional medicine matrix. This is just to remind you of what that looks like. Again, the mental, emotional, spiritual is in the center, and all the biological systems overlap on that. So the microbiome is the grouping and community of microorganisms. It includes fungi or funguses, bacteria, viruses that exist in the human microbiome or in the human ecology. And they're both on the inside of the body and also on our skin, on the surface of the body. So the majority of them are in our digestive tract. And in our digestive tract, we have research evidence that these microbes are traveling up and down the vagus nerve, up to the brain, and hence you have the term that you've probably heard of, gut-brain connection. And also microbes make up at least half of our stool in our digestive system. So this week, we're gonna talk about the microbiome, and today I'm just going to focus on prebiotics, and then I'll let everybody ask some questions about it. And you can post questions at any time, and I will go ahead and address your questions. And this focus of prebiotics is, of course, focused on the microbiome that's in the digestive system. So a lot of people, when they contact my practice, they want to know, one of the questions they want to ask is about what probiotic they should be taking. And I always call their attention to prebiotics because prebiotics are the food for the microbes that are in the digestive system. And so the mix of the microbes in the digestive system is heavily influenced by the foods that we eat, or the prebiotics. And these foods contain high amounts of fiber. So, of course, we have the grains, and oats are one of the grains that's named a lot in the literature. And of course, some fruits like apples and bananas, and konjac comes from a plant, the kudzu plant. I believe it's like the starch in the kudzu plant. that comes from. So, and that contains glucomannan. I think I'm saying that correctly, which helps to bring down the blood sugar. And fiber, we know that fiber slows down the digestion, and fiber in general can help bring down the blood sugar. And certain foods, like when they're cooked and then cooled, form fiber that can also be included in this list. So when we're looking at this list, also notice that garlic, leeks, onions, really everything in that onion family, the alliums, are very, very important prebiotic foods for our microbiome. And what if you guys could tell me which food on here do you think has the biggest bang for the buck according to research on our microbiome, just in general? Like, what's one of the best foods on here that gives a high amount of fiber? It has a fiber substance called inulin. And that inulin is one of the key factors in prebiotics that we're consuming. So any guesses, anybody? Okay. Okay, so artichokes and Jerusalem artichoke. Artichokes and Jerusalem artichoke contain high amounts of fiber and inulin. Okay, so just to recap today, we talked about the microbiome. We talked about that the microbiome contains fungi, bacteria, and viruses. And viruses were just recently discovered in the microbiome, like in the past few years. And they are still trying to figure out how many viruses are in the microbiome. And we know there are tens and thousands, hundreds and thousands of bacteria and many, many fungi that are part of the normal microbiome. All right, so, and then just to recap here, we were talking about foods that are prebiotics, and that prebiotics are foods for the microbes in the digestive system, and that our stool contains about half microbes in our digestive system. All righty, so if you have questions, you can go ahead and post them. I thank you for joining me, Darlene. All right, all right. Let's see. I don't see anybody else joining, so I am going to go ahead and end our session today.